Come in.
Hi, you must be Dr. Mich.
Hi, yes. Are you from GlaxoSmithKline?
Yes. My name is Mark Hawes. I am a drug representative from GlaxoSmithKline, here to talk to you about Treximet, a new migraine medication. I believe we talked on the phone a few days ago.
Oh, yeah, yes. I've been expecting you. Please have a seat.
Well, thank you, Dr. Mich. I really appreciate it. You have a nice office.
Oh, thank you very much. I really like to keep it very family-oriented, pictures of my family, and to just show that we do care about not only our families but also our patients here.
Just before we even talk about anything, I would love to give you my card. It has all my contact information. You can reach me anytime during the day. Believe me, I never sleep in this job.
I know that feeling.
All right. Well, I just noticed that you're a graduate of University of Chicago.
Yeah, yes, I am. I'm very proud of that.
Well, that's actually really fantastic, because I've actually had family members who have gone to University of Chicago.
Oh, really?
Yeah, for special procedures, because our general physician have told us that they have the best specialists in the area.
Yes, I definitely agree with that statement. Not to toot my own horn or my school, but we do have some of the best physicians that come out of there. Students from all over the world, and we treat patients from all over the world. And so, like I said, I'm very proud of our work at the University of Chicago. But it's very nice for you to notice. Thank you so much.
Well, hey, you're welcome, Dr. Mich. One thing I would love to know a little bit more is know a little bit more about your practice.
Well, I am a family practitioner, and I've been in this practice for over 20 years.
Oh, wow.
And in that time span, I've had numerous patients, and I only have, which I'm very proud of, only a 5% turnover rate, which is excluding when my patients pass away, unfortunately. But I'm very proud of my practitioner here, and one of the big things that I care very much about my patients. I want to know that they know that they're taken care of, that what I'm giving them is safe, what I'm giving them will help their illness or their disease, and will put them in a better place physically and mentally. That's why I was interested in when you called about Treximet, because I was looking online last night, and I really liked what I saw. I really liked some of the things that Treximet does, but I also have a few concerns that I would like to get to in a few minutes. But please go right ahead. Thank you again for asking about what I do. It's very I really appreciate that.
I think it's very admirable to see a physician who's been in the game for as many years as you, and still wants to be on top of the new and latest advances in medication. I mean, I think your patients have a really good doctor on there.
Thank you.
Well, I'm here to give you a little brief introduction of Treximet, talk to you about the differences between that and our current medication that we actually have had out in the market for quite a while, and also about our competitors. I also want to talk to you about costs that are associated with Treximet, and also the possible savings that we are offering new patients being prescribed Treximet, and also here to address any kinds of questions or concerns that you have.
All right.
Just to give you a little visual aid here, this is Treximet, our new little baby, and it is a nice little blue pill. Just to talk to you about Imitrex, you may want to, of course you're asking yourself, what is Imitrex? Well, Treximet, my apologies. I get, having to memorize all these medications, I'm kind of just getting lots to digest. Treximet, it's a lot like our current medication that we have out, Imitrex, and also our competitors, Maxol. It is a reliever of between moderate to severe migraines with the active ingredient cimetropam, but also we put in another active ingredient, naproxen sodium, which is which is a pain reliever you see out in a lot of the over-counter medications like Aleve, which sort of adds an additional relief to, which adds extra relief to the patients.
All right, I'm liking what I'm hearing so far. It's funny you mentioned the migraines and relief with that, because actually 25% of my patients suffer from some sort of migraine issues, whether it be moderate to severe.
With that 25%, is there a majority of them that have been experiencing migraines for a good portion of their life?
Yes, for most of their life they have been experiencing migraines, a majority of that 25%, so yes.
Well, I personally believe that this medication is going to be great for those patients that have been experiencing migraines all their life, or a majority of their life, and have previously taken types of migraine medications out there. I really think this would be a bigger benefit, or just like a good core of our business is for patients like that. Did you have any questions or concerns so far?
I actually do. I was wondering, what are some of the side effects of Treximet? Because like I said, I do care about my patients, and also on top of that, I do have a very, very reputable business. I don't really call it a business, but that's what it is, and I just want to make sure that my patients know that they're being cared for, and that they are being given medications that are safe and effective. And I just want to know some of the side effects that might affect them.
Sure, of course. Here's actually a list of the potential side effects that patients could experience while taking Treximet. Of course, with our medication we've had out for quite a while, Imitrex, it has a lot of similar side effects to it, but with Treximet, it does have a few additional side effects due to the naproxen sodium that is in the medication itself.
All right.
Do you have any other concerns or?
I was just wondering about, if one of my patients were on Imitrex or Maxla, which is, I both prescribe both of them. If they were to switch to Treximet, would there be any harmful effects? Would it be safe?
Yes. Yes, Dr. Mich. It would definitely be safe for them. It would be a nice transition from one migraine medication to Treximet. The only thing that we do suggest is that they wait at least 24 hours after they've taken their previous migraine medication before they take Treximet. If they do that, they should not have any problems at all switching over.
All right, I'm liking what I'm hearing so far.
I'm glad.
Just one more thing is that, what are some of the disadvantages of Treximet?
Well, I mean, to be honest with you, and I want to be completely honest and upfront with you,
okay.
The disadvantages of Treximet is that patients do have more side effects to deal with, because with the naproxen sodium being another factor with the medication, yes, there is more side effects to it. Another disadvantage would be cost. Unfortunately, with this new medication out there, a lot of insurance companies don't know if it's going to be very effective, and they may not want to cover it under their prescription drug coverage. So, I mean, it is expensive. I mean, it could run as much as like $30 a pill, which, yeah, it does seem like a very expensive. But, I mean, with these, disadvantages, there is more advantages to the medication itself. A great advantage to it is that it gives patients another option, because we all know that if we take a certain medication for a great period of time, eventually our body's going to get used to it, and it's not going to be effective.
Mm-hmm.
especially with people with migraines, you know, they don't want to feel like that this is all the medication that these are all the medication options out there, and they've taken them all, and they're just going to have to eventually just deal with the migraines again. This gives patients another option to try, and that's one thing we do pride ourselves on.
All right.
And also, we do have special savings and discounts available for new patients that want to take Treximet. And if you actually are seriously thinking about committing to Treximet, we do offer free samples, plus also $50 off your first prescription of Treximet.
All right. Well, I'd like to hear some, except, you know, I do see there's a lot of side effects. How many of these will affect my patients?
It's really hard to say. I mean, every person has their own different reaction to the medication. I mean, as you can see with these patient reviews that we have from our patient feedback portion of our Treximet's website, we have, as you can see here, we have some patients, they comment, you know, they take the medication and they experience no side effects whatsoever, and they, you know, experience relief as little as like 10 minutes after taking the medication. And then unfortunately, if you look over here, yes, we do have patients that have taken the medication and they've experienced some severe side effects, pain in the chest, pain in the joints, pain in the throat, neck, and to the point where they feel like they have to go to the emergency room for it. This is unfortunately some of the cases we don't like to always hear with patients' reactions with it, but unfortunately, you know, like I said previously, is that, you know, every patient reacts to the medication differently.
You know what, I actually would like to, if it's all right with you, if I can make a copy of these and show them to some of the doctors that I work with and that I consult with, if that's okay with you guys, because I really think testimonials are a big issue, big factor when just deciding whether to try a new product or not.
Well, yeah, by all means, take it. I would love to have other doctors' opinions and see what they think. Would you consider prescribing Treximet to your patients?
You know what, I would give you my full offer, but I have to consult with my the doctors I have, and with the doctors that I have accountability with. We work together, we hold each other accountable, and we make sure that our patients are being treated with kindness and with care. And so I'm going to have to consult with them and some of my other staff. But I'm feeling very positive about Treximet. I'm excited to see where this goes. I have a very positive feeling about it. I have your number on here, and I will be in contact with you actually in the next couple days to give you my final decision. But like I said, I'm feeling very positive about this, and I'm very excited about the opportunity.
Well, I'm glad that you're really positive about it, and that really makes me feel really good inside. And I appreciate the time you've taken out of your really busy schedule to be able to hear me. And thank you for, just like I said again, just thank you. And you have a great day, Dr.
All right, thank you. You too, Mr. Hawes. I look forward to working with you, hopefully.
Me too, Dr. Mich. Me too, Dr. Mich. You have a great day.
All right, you too.
Thank you.